Hello, I'm Master Delpe. I'm the designer and creator of DOJAPem. What is DOJAPem? D is diabetes, O obesity, J is joint problems, A is arthritis, and P is pain. And EM is energy management. And it's also called sometimes energy medicine. So DOJAPem is a system which I have created to address the needs of people who are suffering from diabetes, obesity, joint problems, arthritis, and pain, using energy management technique which I have developed for more than 2 decades. I have experienced healing people who are suffering from these ailments, and I can empathize how difficult their life is and loss of the quality of life when you suffer from all of these combined. I have not seen any system or modality as of today that combines an integrated approach that will deal with the complexity of, say, somebody with diabetes, obesity, and joints and pain all together. Well, you need 4 or 5 doctors to deal with those separate conditions. In DOJAPem, I have integrated and synthesized the energy management system to be able to deal with all of them simultaneously, using healing technology and the healing science, which combines with life coaching, with special exercises, with special breathing science and meditation science to heal not only correctively the diseases, but preventively. So it is both preventive and corrective measure, and also for those with lifestyle diseases or the people who have genetic conditions. We will also help them prevent them as much as possible. The good thing about DOJAPem is it addresses the ability to heal and release some of the side effects of these diseases. For example, if you have pain, you have also sleep deprivation, or it can lead to depression or anxiety or other emotional or mental conditions. DOJAPem addresses both the physical aspects, the energetic aspects, the emotional aspect, and the mental aspect, including even the karmic aspect of these diseases. So DOJAPem was created not only to help people, accompany them in the process of recovery and dealing with the side effects of these diseases. We also train and certify people. Either you are a healthcare giver, a healer, or a person with families who have these genetic problems, or even yourself having this problem. We will help you with tools, with healing techniques, with breathing science methods, with meditation for healing these diseases, preventive or corrective in nature, and equip you with these tools so you are not at the mercy of pain with all kinds of side effects that you can take from this diabetes, obesity, joint problems, arthritis, and pain. So I'd like you to attend our lecture that will give you an orientation on how to participate. If you were the patient, or if you have families with these conditions, you can also attend. Or if you are a healer or a healthcare professional, or somebody who wants to make this as a part-time or a full-time career, to come to our lecture, January 7, 2014, in New Delhi, India, and we will give you a more detailed announcement about the side effects and information about this disease afterwards. Visit us at www.dojapem.com, DOJAPEM.com, or write us info@masterdelpe.com, info@masterdelpe.com. Well, to give you more detailed information regarding the Indian component of DOJAPem, because I'm launching this in India because I have seen a lot of my patients in India having all these problems, and in combination, it's not just one of them. It's not just diabetes. You have obesity with diabetes, and joint problems, and arthritis, and sometimes pain with it. So if you look at diabetes in India, diabetes in India is one of the foremost problem of this culture, I think second to China. It is a global diabetic center, if you might say. According to the International Diabetes Federation, IDF, the November 14 report, 2012, stated that India has 63 million people living with diabetes. And it is around 8.3% of the total population being diabetic. We have also around 1 million deaths every year due to diabetes. And around 60% of diabetes in India also go undiagnosed. So you can just imagine the impact if we don't have any complementary or alternative medicine to this, because it's not been fast enough to solve this in terms of the complementary medicine side. So DOJAPem has been included as part of the complementary and alternative medicine to diabetes. Now, obesity in India is also big. In fact, it's considered as a killer lifestyle disease today and is an important cause of preventable death worldwide. According to the World Health Organization, around 1.2 billion people worldwide are officially classified as overweight. And more than 5% of the Indian population is obese. Obesity and overweight poses a major risk for chronic diseases, including type 2 diabetes, cardiovascular disease, hypertension, stroke, and other forms of cancer. Now, in terms of joint problems in India, we have a lot of issues, the wear and tear of the knees, the hips. We have a lot of knee and hip replacements, surgery done in India. As you grow older, the wear and tear of the knees and the hips, for example, will pose not only as a pain item, but also the inability to move properly and effectively will kill your quality of life. So we have addressed joint problems as a big issue in India as well, and also in elderly around the world. Well, arthritis in India is one of the causes of a lot of discomforts, a killer of the quality of life. Over 15 million in India are suffering from arthritis each year, and osteoarthritis is the most prevalent form of arthritis and the leading cause of disability in people in India, especially the old people. Over 40% of the Indian population in the age group of 70 years and above suffer from osteoarthritis. About 20 years ago, osteoarthritis was known as a disease of the elderly, affecting those age of 65 years and older. However, the orthopedicians are increasingly diagnosing younger people in the age group of 55 and even 35-year-olds. While India is the second largest knee osteoarthritis infested country in the world today. Well, pain does not only affect Indians, but people around the world. But pain is like an epidemic for the majority of population, especially in India, and is the leading cause of severe disability, especially in the elderly. Has a severe social and economic impact, and it also brings codependency to families in India. If somebody is in pain in your family, you would have a lot of this empathic pain as well. Well, the physical and psychological sufferings caused by pain can lead to a lot of loss of productivity in working hours. And it will, of course, dent the economy caused by absenteeism or lack of productivity. Now, in India, pain management is still in the stage of infancy, and as compared to the Western countries. So India is starting to catch up with the management of pain. Now, the WHO predicted that the chronic pain from India will be around 19%. That's the latest finding. So it can increase more because of people's lack of exercises, sedentary nature of Indians, and also the pollutions around, the poor diets and lack of recreation facilities, and all kinds of causes. So DOJAPem, diabetes, obesity, joint problems, arthritis and pain, energy management, is the solution today which will augment the skills of the doctors and the normal sciences with our healing technology and our healing expertise, combined with life coaching to prevent the side effects of these diseases, and also it poses an antidote to this kind of diseases. So I'd like to invite you to investigate and maybe join our programs to be able to receive this help if you were a patient, or if you have clients, or if you have families and friends who have these problems. Let us know and we can help you and accompany you in faster recovery. Or if you are a healthcare giver, a doctor, a nurse, a healer, a person who is interested to help others, you can make this also a part-time career or full-time career. We need 2 years of your time. It's not every day, but periodic education through online workshops, in-person training, and even retreats to hone your acumen to heal all of these diseases and its combination and their combinations. But if you just want to specialize on, say, diabetes, then you can need 6 months, or obesity, or the other 2 other diseases. But if you want to complete as a specialist for DOJAPem, you need 2 years to be certified and to be proficient in dealing with the preventive and the corrective measure regarding these diseases. So welcome all, and welcome to those who want to explore the new possibilities of complementary medicine or energy management. January 7, 2014. Visit us at www.dojapem.com or write us info@masterdelpe.com. Good luck! Joint problems, arthritis and pain, using energy management technique which I have developed for more than 2 decades. I have experienced healing people who are suffering from these ailments, and I can empathize how difficult their life is and loss of the quality of life when you suffer from all of these combined. I have not seen any system or modality as of today that combines an integrated approach that will deal with the complexity of, say, somebody with diabetes, obesity, and joints and pain all together. Well, you need 4 or 5 doctors to deal with those separate conditions. In DOJAPem, I have integrated and synthesized the energy management system to be able to, and EM is energy management. And it's also called sometimes energy medicine. So DOJAPem is a system which I have created to address the needs of people who are suffering from diabetes, obesity. Hello, I'm Master Delpe. I'm the designer and creator of DOJAPem. What is DOJAPem? D is diabetes, O obesity, J is joint problems, A is arthritis, and P is pain.